Effects of population on health. The effects of population on health can be seen in many countries around the world. However, the effects of population on health are especially visible in developing countries, where there is a high rate of infectious diseases and few resources to combat them. This blog post will discuss some effects that population has had on health in different parts of the world and some future projections for how those effects might change with increasing or decreasing populations. Effects of population on health in developing countries. The population of developing countries faces myriad health problems that the rapid growth in people has exacerbated. In Africa, for example, there has been an increase in cholera outbreaks and malaria as more residents flock to urban areas. In addition, the living conditions imposed on these individuals can be detrimental because they lack proper sanitation practices, leading to higher rates of bacterial infection from food poisoning or untreated wounds caused by unclean water sources such as contaminated riversides or ponds where children often play unattended while their parents do errands nearby. The population size of a country affects the health records for that area. The more people, the greater chance there is to have someone with infectious diseases like malaria or HIV/AIDS and other ailments such as diarrhea, which can all lead to death if not treated in time. Effect of population on health in developed countries. As populations grow, so does the demand for healthcare. Maintaining a healthy population is an important goal in developed countries that currently have access to these resources. However, population growth can be harmful if not managed properly. It strains economic and social systems and natural resources such that health may suffer due to lack of available services or time required from caretakers who are now caring for more people than before, for example, family members. The population is a very important factor when it comes to health in developed countries. It can help or hinder the quality of life for individuals by influencing many things such as economic, social, and physical well-being due to factors like education levels, employment opportunities, and access to resources like food products that are healthy with nutrition values. This means different regions could also have varying standards based on these three key elements, which will affect how they handle healthcare needs as populations grow rapidly across the globe. The population affects everything around us, but those who live in areas where more people need an extra bit of care from their governments, because not only do certain sectors face changes but so do law enforcement agencies, since crime rates would be higher than normal. Schools may experience overcrowding. Effects of population on health in rural communities. The population of a rural community can affect health, as more people means that there are bound to be more cases. This is because with an increase in population comes increases in infectious disease transmission. Foodborne illness outbreaks due to lack of clean water and sanitation facilities. Occupational hazards for agricultural workers such exposure to toxic pesticides or dangerous machinery can result from increased demand on agriculture production. In many communities, residents cannot access quality healthcare because the nearest hospital and doctors are far away. In fact, in some regions of rural America, there is only one doctor for every 30,000 people living in those areas. This has a massive impact on their overall well-being, as they may need emergency medical assistance at any time without warning or notice. Not having immediate access means that these individuals can waste precious hours traveling long distances towards hospitals while risking injury during accidents along the way from car crashes and other mishaps, which would otherwise be avoided if they were closer by when needed. The lack of nearby resources also affects mental health conditions such as depression, since it's often difficult getting help with treatment due to financial constraints. Effects of population on health in urban area. Urbanization has been shown time after time over centuries past through countless examples across many parts around the world, including India or China, how it poses a significant risk factor for human health because large population. It is essential to understand the effects of population on our health in urban areas. By understanding these factors, we can better protect ourselves from many diseases and illnesses that are more prevalent among densely populated cities, such as increased pollution levels, leading to an increase in respiratory problems for those who live there. This particular area should be looked at with a broad scope because it has been shown that this type of living environment increases stress, depression rates, and other psychiatric disorders due to higher competition within their peer groups socially or academically. Expanding into greater detail about how society views lower socioeconomic status people would help make this passage more interesting by giving readers insight into what might have caused economic inequality throughout generations where poverty was passed down through families like here. In order to save our planet for future generations, we need to reduce the effects of population on health. Effect of population on health disease. The effects of a population on health disease are vast and can be found in many different facets. For instance, the spread and prevalence of diseases are often influenced by how densely populated an area or region is. In this case, it would make sense for those who live near one another to suffer from similar illnesses because they will have more contact with others, such as sharing food supplies that could contain contaminated materials like bacteria or other microorganisms. Too many people in a given area can increase disease due to the increased likelihood that someone will carry and spread it. Effects of population on health are important to know so that we can control them. Effects of population on children's health. It's no secret that population size is an essential factor in many aspects of our lives, including the health and well-being of children. However, what may not be as obvious are the specific ways this reality affects kids' health, ranging from basic to life-threatening. For starters, a higher volume or density of people means more opportunities for diseases to spread by way of close contact with strangers who might have been exposed elsewhere before coming into your community. Even if they aren't sick when they arrive, there could very quickly become so after their exposure at home turns them against you. That said, one study found that while living around lots of other people increases some types of infection, it decreases others because we're less likely to engage in high-risk behaviors. The effects of population on children's health is a topic that has existed for millennia. Questions about the correlation between city size, natural resources, and quality of life have been posed since time immemorial. A recent study by Dr. Daphne Wang, in conjunction with UCED, investigated these questions as they pertain to child mortality rates across various cities worldwide. This included data from China, India, and Brazil, amongst others, whose populations are currently seeing exponential growth due to immigration into urban areas coupled with childbirth policies like one-child policy enacted decades ago, which prevented families from having more than one offspring at any given time. Effects of population on health. Effects of aging population on healthcare costs. Experts have long predicted that the aging population will significantly strain healthcare costs in America. However, the latest research suggests this may be happening sooner than initially anticipated, with experts projecting an 11% increase by 2024. Experts predict there could soon come a time where Americans are paying for more costly medical treatments out of pocket as they age, while simultaneously feeling less like working because their bodies can't handle it anymore and leave them dependent upon government programs such as Medicaid to provide coverage without some work requirement attached. This is often seen among people who retire early or find themselves unable to keep up with physically demanding jobs after years away from physical activity due to illness or injury before retirement. These older adults now need new hips, knees, and others. Effects of population on health are hard to understand, but we all need to work together to control these causes. Effects of population growth on health service provision. It is well known that the world's population continues to grow at a rapid rate. This increase in the global population can have many adverse effects on society. One of those is reduced access to healthcare services due to insufficient doctors and nurses available. As people live longer, they require more medical attention for chronic diseases such as diabetes. There are also significant health disparities between rural and urban areas. It takes much more time for resources from wealthier regions to reach poorer ones, so the disease may spread before diagnosis or treatment occurs. For example, when you look at Africa, there are vast differences in life expectancy rates depending on location. People living close by major cities typically live up 10 years longer than their counterparts who reside far away from these centers. Effects of population growth on reproductive health. The effect of population growth on reproductive health is evident in the steadily decreasing fertility rates across many different countries. In China, for example, one study shows that there are fewer women now getting married and having children than before because they don't want to give up their jobs or take care of family members with declining health. With over 7 billion people, many countries are facing various challenges in providing reproductive health services to their citizens. Reproductive health is essential for everyone, but it becomes especially vital when there's too much pressure on the system from increased populations with limited resources like food, water, or housing opportunities. The more impoverished places will suffer most because they don't have enough money to invest in healthcare infrastructures such as clinics where women can go for gynecological examinations without having to pay out-of-pocket fees or other barriers which would make them less likely to access these facilities either due to lack of awareness about what treatments exist outside regular visits,